Medicare doesn't make any sense, but here at Healthcare Solutions Direct, our goal is to make this simple as 1, 2, 3. When it comes to Medicare not making any sense, for most individuals, the Part D prescription drug plan is one of the things that just doesn't make any sense. So we're going to attempt right now to make this really simple and easy to understand and know everything about prescription drug coverage as well as the penalty that someone could incur with a Part D drug plan. This is the part of Medicare that will help an individual pay for medication that are prescribed by a doctor outside of a hospital setting. Medicare added outpatient prescription drugs to its coverage on January 1st, 2006, known as Part D. This is one of the biggest benefits to Medicare, but again, it's also led to a lot of confusion because some prescriptions can still come at a high cost to an individual. An individual transitioning from an individual or a group insurance plan will not see much of a difference when it comes to generic medications, but they could be in for a shock when it comes to how brand name medications are handled under Part D. So let's discuss brand name medications still being costly under Part D. See, most individuals on Part D will find themselves being prescribed generic medications, which could be a little to no out-of-pocket copay. Most brand name medications, though, have generic equivalents which can keep the cost manageable for that individual, which is great. An individual coming off of an individual or group plan where they were prescribed a costly brand name medication might need to move to a generic equivalent for cost reasons when they're looking at a standalone PDP or an MAPD Medicare Advantage plan. A problem an individual could encounter on Medicare Part D is if there's not a generic equivalent to the medication prescribed or the generic version does not work as well for their current situation. So one thing about group plans is that they can offer some great prescription drug coverage. See, employer group insurance plans offer incredible benefits to their employees, and this is because employer contribution financially makes sure that the prescription drug coverage offered is very, very robust. So the employer group companies a lot of times will financially put a lot of money into the prescription drug coverage for their employees. So an individual coming from that employer group insurance plan will not have the same benefits, though, when it comes to their Part D prescription drug coverage, since the employer is no longer contributing to that drug plan. So hopefully that makes a little bit of sense right now, is that if you're on a group insurance plan, your employer is paying a lot of money for the prescription side of it. When you're going into Medicare, unfortunately, that employer is no longer contributing to the prescription drug coverage. So we discussed earlier that if an individual is still working and they're taking high-cost brand name medication, it's important for them to compare their employer group coverage with that of Medicare Part D. The individual could be paying a $10 copay for their brand name medication under the employer plan, but then find that same medication could cost them over $200 through the Medicare Part D drug plan. So remember, most retirees, though, the good news is that they are prescribed generic medication, which is fantastic. See, generic medications should be inexpensive and affordable under Part D drug plan if someone uses the plan's preferred pharmacy network or mail order program. So if you're taking a generic medication and you're going on to Part D right now, the great news is this, that you should have some really, really good plans available to you that you can have low cost to a little copay if you use the preferred pharmacy network or use the mail order program. By the end of the section, you're going to understand each of the 4 stages of Part D prescription drugs. Make sure to watch our video on the 4 stages of prescription drug plans so you have a better understanding of the 4 different stages. You'll know how the coverage gap donut hole works, which a lot of people hear about when an individual is prescribed some brand name medications. You will know everything about the Part D to make you a Medicare expert when it comes to your outpatient prescription medications that you're given. Let's just talk about some quick basics of Medicare Part D. Medicare Part D is provided by private insurance companies and not by Medicare, so it's the first thing you need to understand. CMS never got into the prescription drug market, but they do oversee it, and they have rules in place that every company must follow. See, CMS focused their attention on both hospital Part A and medical Part B and making that the foundation of the federal health insurance program for those that were eligible for Medicare. So Medicare and CMS really made Part A and Part B the foundation, and that's what they really focused all their attention on. Part C and Part D are provided by private insurance companies, and each company and plan must be approved by CMS before it can be offered in someone's zip code. So remember, Part C and Part D are awarded a star system by CMS in order to rate its efficiency and customer service. So if the star system falls below a certain threshold, CMS will then step in and sanction that company and plan to make sure that either they get the star rating up or at the end of the day they cancel that plan altogether. So let's discuss real quick. We've talked about in previous videos, but it's worth repeating. There are two ways to get prescription drug coverage. There's only two ways that an individual can get their prescription drug coverage when they're eligible for Medicare. The individual can purchase a standalone plan if they have original Medicare Part A and Part B, known as a PDP, with Medicare as their primary insurance, or have it included as a benefit in their Medicare Advantage plan. Here's something that you should know about the standalone PDP plan. An individual enrolled in an MAPD, a Medicare Advantage Prescription Drug Plan, or an MA plan that decides to enroll into a standalone PDP plan will automatically be disenrolled from their Medicare Advantage plan back to original Medicare. So let me repeat that again. If you have an MAPD or an MA plan and you decide to go ahead and sign up, enroll into a standalone prescription drug plan, that will cancel your Medicare Advantage plan and it will take you right back to original Medicare. A standalone PDP can only go with original Medicare Part A and Part B. An individual cannot have a standalone PDP and an MAPD or an MA plan. They must have one or the other. Remember, we talked about this in a previous video. The only Medicare Advantage plan that will allow someone to have a standalone PDP plan is a Medicare Savings Account MSA plan because they do not provide prescription drug coverage. This is the only exception to CMS's rule. And a lot of times, again, why Medicare sometimes does not make any sense. So everyone eligible for Medicare should have Part D. So let me say that again. If you're eligible for Medicare, you must have a Part D drug plan. And individuals eligible for Medicare should enroll into either a standalone PDP or a Medicare Advantage MAPD plan that includes prescription drug coverage when they're first eligible for Medicare during their 7-month initial enrollment period IEP. Even if the individual is not taking a prescribed medication, they will need to pick a Part D plan in order to avoid Medicare's late enrollment penalty, which we're going to talk about here in a second. Although prescription drug coverage is voluntary for those that are eligible for Medicare, and an individual will owe a late enrollment penalty if they do not have credible prescription drug coverage after their 7-month initial enrollment period IEP. An individual that delays Medicare Part B because they're working with employer group coverage that includes credible prescription drug coverage will not owe this late enrollment penalty when they enroll into a special enrollment period SEP because they had credible prescription drug plan through their current group insurance before they joined into Medicare. It's important to understand the Medicare Part D 63-day rule. Medicare's rule is that after the 7-month initial enrollment period IEP, the individual cannot go more than 63 days without credible prescription drug coverage. A prescription discount card will not count as credible prescription drug coverage. Credible prescription drug coverage must be either through an employer-sponsored plan, through VA coverage, a standalone PDP, or an MAPD. So again, let me just say that again. Credible prescription drug coverage can only be through an employer-sponsored plan, VA coverage, standalone PDP, or an MAPD, Medicare Advantage prescription drug plan. A prescription discount card will not be considered credible prescription drug coverage and may not help someone that is taking a high-cost brand name medication. This is some big misinformation a lot of individuals get, is they can use a discount card instead of picking up a Part D drug plan. Now that might work for a little while, but if you're prescribed some high-cost medication, this might not be a very good option for you. A very popular discount card like GoodRx provides discount drug coupons, but would not give much financial assistance for a commonly prescribed blood thinner to prevent blood clotting like one called Xarelto. So a very popular blood thinner is Xarelto, which is prescribed to a lot of individuals. A Part D drug plan would be a big help financially for an individual in that circumstance, because even with a discount card for the Xarelto, it could cost over $500 a month for that particular prescription. We'll talk a little bit more of some examples of this a little bit later. Medicare Part D plans will have a list of covered drugs that are listed on what's called a formulary, and they're going to be broken down by tiers, which we're going to talk about a little bit here in a second. The lower the drug appears on the tier, the less the individual will pay out of pocket for that prescribed medication. There are generally 5 tiers that a prescribed medication will fall under with the Part D drug plan. Let's get familiar with the 5 Part D drug tiers. So when you're looking at the drug tiers, you are familiar with each one of them. The first drug tier is a preferred generic. This will be a very common generic medication that's prescribed. These will have a very small copay of $1 or $3, and it may even be free under a lot of different plans with the Part D. The second tier is non-preferred generic. This will be a generic medication that the plan did not negotiate a lower cost to be considered a preferred drug under the plan. So it's still a generic medication, but it wasn't negotiated under a preferred side of it. It was negotiated as a non-preferred. These will typically have a $7 to $13 copay under the plan. Now we get into the brand names, which is tier 3. A preferred brand name, this will be a brand name medication that does not currently have a generic equivalent. This will have a copay typically around $35, but will probably move someone into what's called the coverage gap or the donut hole, which we're going to talk about here in the 4 stages of Part D. A medication like Xarelto would usually fall under this tier of preferred brand name. Let's talk about the 4th tier, which is non-preferred brand. This will be a brand name medication that does not have a generic equivalent, and just like non-preferred generic, they were not negotiated as a preferred brand name medication by that drug plan. This will have a copay of 95 to 50% cost sharing depending on the actual plan. The last tier is called the specialty tier. This will be for the most expensive drugs that are typically used to treat severe conditions like cancer or multiple sclerosis. This will typically not have a copay, but will have a cost sharing of around 25%. This type of medication will have an individual move into the catastrophic coverage phase of Part D, which we'll talk about under the 4 stages. So when it comes down to prescription drug coverage, it's really important that you call us here at Healthcare Solutions Direct so we can shop all the different prescription drug plans to make sure that the drug plan that we're looking at is going to give you the very best cost. So when it comes to Medicare Part D, it's really important to look at network pharmacy. So when an individual is looking to keep their costs down for their prescriptions, there are 3 things that they can do. The first thing is make sure that whenever possible, be prescribed a generic medication. Most medications now have a generic equivalent that will keep the cost down. The second is to use a preferred in-network pharmacy to fill those medications. Part D drug plans have a network of pharmacies that agree to discount the prescription to its members. This may require an individual to use a preferred in-network pharmacy in order to get the lowest out-of-pocket cost copay for that medication. The last thing an individual can do is to consider a mail order program offered by that plan. This will typically provide lower cost and save the individual time from needing to go to the pharmacy to actually fill that particular medication. Many individuals are surprised to find out that there is a penalty if you do not have a Part D drug plan, either through a standalone PDP or through an MAPD plan. So if someone does not have credible prescription drug coverage after their initial enrollment period, their 7-month initial enrollment period, then there will be a penalty that Medicare will now assess to that individual. They will assess a 1% penalty for every month that the individual does not have a Part D prescription drug plan. Now remember, in order to go ahead and purchase a Part D prescription drug plan that's standalone or an MAPD prescription drug plan, that individual would have to wait until the Medicare open enrollment period between October 15th through December 7th. So let's discuss this. Let's say that an individual went 3 years without having any type of prescription drug plan. So they went 36 months without any prescription drug plan. So what Medicare does is this, is they have a national base amount that they calculate for the prescription drug plan. So in 2021, it was $33.06 was the national base amount that Medicare had set for a prescription drug plan. That was the average that they had set across the board. So if someone went 36 months without prescription drug coverage, Medicare would take the $33.06, they would multiply it by 36% for 1% for every single month, so 36%, and that would have a penalty of $11.90. What Medicare would do is they would round that up to the nearest tenth, So that individual would have a $12 penalty under Part D. So when that individual signed up for a prescription drug plan through the standalone PDP, whatever that amount was for that prescription drug plan, they would also have an additional $12 that they would be responsible for as a lifetime penalty for the prescription drug coverage. The same would hold true if they had signed up for an MAPD, Medicare Advantage prescription drug plan that was all in one. Even though the plan might be $0, they would have a $12 penalty that they would have to pay every single month because it's a lifetime penalty. So the conclusion to this is this: if you're not taking any medication, it is very important that you do sign up for a prescription drug plan under Part D, whether it's through a standalone PDP or through a Medicare Advantage prescription drug plan. You need to have that because there will be a time down the road that you probably will need prescription drug coverage where a discount card might not do what you're needing it to do, and it would be very, very important that you had this in place. So if you're not taking anything, please go ahead and give us a call so that we can look through all the prescription drug plans. We can get you the lowest cost one for a PDP prescription drug plan so that it satisfies Medicare's requirement of having prescription drug coverage either through a PDP plan or through a Medicare Advantage plan. We look forward to your call. We look forward to helping you out here at Healthcare Solutions Direct so that you're making the right decision for your needs.